presentation is going to be on trauma within children, and it's by me, Isis LaRue, Hannah McPhail.
Hannah Markets.
And Cindy Lee.
Okay, so we will begin by introducing our PICOT question. In children who have experienced trauma, how do early intervention programs compare to those with no interventions in reducing trauma-related symptoms? Our population on children who have experienced trauma, intervention for early intervention programs, and comparison to no intervention, with the outcome of reducing trauma-related symptoms within no time frame.
Okay, so this is just a slider scale of where all of our interventions fall. Two of us did articles that lean more towards childhood interventions, and two of us did no childhood interventions.
All right. So just starting off the first article, it was found on the database CINAHL Ultimate using the search terms effects of childhood trauma on development with and no therapy, with the limitations of within the past 5 years, only peer-reviewed and in English. The journal name is Repairing the Effects of Childhood Trauma, The Long and Winding Road. So, this journal discusses a case study on the long-term effects of an individual's childhood trauma. It delved into the long path of recovery from the perspective of an individual who endured physical and emotional abuse throughout her childhood. So, one of the quotes I just wanted to point out was there's a strong relationship between childhood abuse and neglect and the later development of mental health issues, particularly depression and post-traumatic stress disorder. So, in summary, the focus was pulling information about how this individual's trauma had and was affecting her life without any sort of therapy or other interventions being implemented during childhood. Following the abuse from her father, she developed a trigger when faced with an authoritative figure, and it took until age 40 when she started therapy to discover and acknowledge this trigger. Due to her lack of knowledge and awareness, she endured many hardships, unaware as to why certain situations were triggering her. Although each healing journey is different, her story serves as an example of one possible path if an individual does not receive any help slash has any interventions implemented.
Okay, so for Article 2, the journal name is Trauma Focused Cognitive Behavioral Therapy for Children and Young People Who Have Experienced Forms of Child Maltreatment Other Than Sexual Abuse, a review of the evidence. For the rationale, the article discussed the effectiveness of trauma-focused cognitive behavioral therapy on children who have experienced forms of maltreatment. This article focused on those experiencing physical abuse, emotional abuse, domestic violence, and neglect, excluding sexual abuse. The study included a structured treatment model for children aged 3 to 21. It involves 12 to 20 sessions of individual therapy. The treatment follows a phase-based approach with components like psychoeducation, relaxation, cognitive coping, trauma narration, and gradual exposure to trauma reminders. Registered counselor therapists showed that trauma-focused cognitive behavioral therapy has a positive effect on post-traumatic stress symptoms, anxiety, strengths, functional impairment, and also potentially depression and emotional behavioral difficulties with mixed affect. In summary, trauma-focused CBT is an effective treatment for children experiencing maltreatment, excluding sexual abuse. CBT has shown significant benefits in reducing trauma symptoms and improving overall well-being. There are limitations to this kind of therapy, as more research is necessary to determine effectiveness across cultural groups and maltreatment types.
And moving on to Article 3, my database was the same as Kiana's, which was Science Direct. And my article, the article discusses how child abuse is a risk factor for trauma-related disorders, including post-traumatic stress disorder or PTSD. With the absence of interventions, this interpersonal trauma may result in identification with the aggressor, or IWA. This includes taking on behaviors, perspectives, and beliefs of the person who caused harm to the individual. And one quote that I wanted to point out was victims of abuse undergo the replacement of their own agency with that of the perpetrator, losing connection to their own feelings, urges, needs, and becoming passive and obedient, not only behaviorally, but also mentally. They develop heightened sensitivity towards their perpetrators by becoming highly attuned and learning their perpetrator's feelings, needs, moods, and intentions, as well as who their perpetrator wants them to be and how to appease their perpetrators. So, in summary, IWA and child abuse survivors rely on coping mechanisms that include dissociation and leading to self-perception that is distorted. This focuses on prioritizing the perpetrator's feelings rather than their own, leading to unresolved feelings and a loss of self-worth.
Okay, so finally, we're going to move on to Article 4. My database was Academic Search Complete. This article explores how interventions such as extracurricular activities may alter a child's response to trauma and assist in managing stressful events bloomed through stability, security, safe experimentation, and healthy challenges. Overall, the article discusses how youth can form relationships with both peers and coaches in a healthy manner. This will provide stability to their life and allow them to seek guidance from their mentor when needed. The child can practice their skills in a manner that is familiar. And within the team, the child has the opportunity to feel accepted and be a part of a project that removes them from the unstable aspect of their life. Overall, sports acts as a multidisciplinary tool to help youth who have or are going through adverse childhood experiences, rewiring their brains to process stress in a mentally engaging manner while promoting wellness.
All right, so kind of in conclusion here, the two different sides, the no intervention versus early intervention. Just starting off to summarize the no intervention, comparatively, lack of interventions inhibit the youth from connection with their thoughts and feelings. As noted from Article 1, clients were not able to recognize triggers and continued to put themselves into a harmful situation.
A quote that was pulled from my article where clients can feel like they're responsible for perpetrators' feelings and actions. They take on others' feelings rather than processing their own feelings and emotions, which can lead to blaming oneself.
And piggybacking kind of off all of that from my article again, there's no assistance with development of healthy coping skills, and all of this combined can leave individuals predisposed to adverse mental health issues later on in life. And then, so now going into the other half of our studies, early intervention, which Kiana and Hannah went over.
So, early interventions are more effective in promoting positive coping and self-regulation.
And pulling from article number 2, cognitive behavioral therapy has shown significant benefits in reducing trauma symptoms and improving overall well-being, as well as early interventions allow youth to grow into healthy, well-adjusted adults and prevents mental health disorders from escalating or forming in the first place. And CBT also allows for children to develop better, healthier relationships with caregivers and their peers.
In addition, sports provide a space that is safe and welcomes small hardships controlled by youth. Being a part of a team helps form relationships with peers and adults that differ from the instability of home, developing an understanding of abnormal environments. When we reflect back on our PICOT question, in children who have experienced trauma, how do early intervention programs compare to those with no interventions in reducing trauma-related symptoms? We mostly look at their coping skills. So no interventions, these children are developing either unhealthy or no coping skills versus early intervention who are able to promote positive coping skills as well as self-regulation, which differ in how they affect and how they form relationships with peers and mentors.
In addition to Hannah, when comparing specifically the reduction in trauma related symptoms, it was found that individuals with no childhood interventions had vast struggles and at times added on to the root trauma. Most individuals didn't receive any guidance in identification and healthy coping strategies, which can increase their trauma related symptoms such as panic attacks, depressive episodes, and many more adverse symptoms and experiences. But comparing over to individuals who did receive early interventions, many still experience these after effects, but with the implementation and guidance with navigating their emotions, this allowed for more positive outcomes. These interventions allowed youth to grow from their past, develop healthier relationships, and be given outlets for their stress in a controlled environment. Of course, effectiveness of interventions differ from each person, but it was seen as an overall that it seems to reduce the trauma-related symptoms with the intervention of early programs. And just as a reminder, please take a break. I don't know if you guys have watched multiple presentations, but just a reminder, take a break. It's great to take a nap sometimes.
All right, and then references.
Thanks for watching, everyone.
Thank
Woo!
you.